480-774-8200 is the number to call to join the conversation, along with John Murphy and Michael Berens. Gentlemen, we are now joined by Paul in Mesa. Paul, thanks for calling Here and Now. You're on the air.
Hey, thanks. I'm a naturopathic physician and president at Southwest College of Naturopathic Medicine, and so I'm especially excited by the potential for the research that you're describing for prevention. That'll go, I think, a lot further than the early detection methods that we use today. And I have a quick comment and a question. The comment is that we also have to make sure that physicians have the time and the tools to take a detailed history for personalized medicine that takes into account the patient's physical, mental, and emotional state. And I was wondering if you can please elaborate on how your research will benefit people in personalizing their nutritional and exercise programs and help us move away from what I would call like a one-size-fits-all approach to diet and exercise.
Paul, thanks very much for the phone call. Mike Berens, let me start with you on that.
Well, Paul, I think you raise a very exciting aspect, and one of the things that I'll just use as my heading in the response to it is the patients, me, us citizens, we get to take ownership for our health. And I think that your comment says, I don't want one size fits all. I don't want just what today's physician or clinical staff is going to ask me. I want to start taking a higher level of ownership about my own health. What a wonderful transition where we're more an active participant in that. So when we think about a physician taking history, I would envision that we're going to see the evolution of a history document that's sort of a living document that would travel on a smart card in our wallet or whatever the nomenclature is. And in fact, we can update that, and there would be fields of nutritional background, possibly toxic exposure based on a zip code where we lived or where we've traveled. And those things would start now to feed into bigger data sets that would give us insight about why we would have wanted to ask for that information, but we weren't smart enough to do that. And so I think we're approaching an era where this information that at the moment we just don't know what to do with it, so we don't collect it. But I think that's going to start to assemble into much more empowered preventive measures or who's at risk for disease because of lifestyle choices, including nutrition and environmental exposure.
John Murphy?
I think what we're touching upon is that the genetic analysis and the sequencing of some years ago enables us now to identify hereditary traits for each individual. But what the protein analysis will enable us to do is focus on lifestyle and environmental effects. And that's a first breakthrough. So I think what, again, Dr. Berens describes in terms of the smart card is probably where things are going to be headed.